Hi there, I'm Dr. Heidi Jays, chiropractor from Best Weight, and today I'm going to be collaborating with one of my very good colleagues, Dr. Naim, who's an OBGYN specialist. We will be speaking about health and nutrition as well as anti-aging and hormonal conditions which may affect women and cause obesity and weight gain. Hi, Dr. Naim, are you there?
Good to see you. It's always a pleasure to collaborate with you. As you know, I'm a OBGYN and I treat my patients from the medical point of view. I know you have training in holistic and functional medicine, so it's good to see how we can treat the patients from both angles, and as far as diet and nutrition, how we can help them with many women's issues. So it will be great to see what we can do for them.
Absolutely. So before we start to speak about the chosen topics today, I would like to tell the viewers and our followers that we will be offering a very special promotion at the end of this video. So make sure that you do watch it to the end. Okay, so our first topic that I wanted to speak to you about, Dr. Naim, is postpartum weight loss. So a lot of times patients come to my practice after delivering a baby, and regardless of what they do, they just find it impossible to lose weight. So why is it that it's so difficult to take off the baby weight?
Yeah, so in general, most women gain about 30 pounds during pregnancy. Some women gain more, some less. Patients are gaining like 50, 60 pounds during pregnancy. And after the delivery, a lot of time they have problem losing this weight. Some could be because lack of sleep, maybe from lack of exercise, from stress, from the fact that they breastfeed and they don't have their cycles. This all could be a factor. Also, having a baby, the muscles become more relaxed and more fatty tissue under the skin. So these are all the factors that promote this weight gain and makes it harder to lose it. I usually tell my patients to follow a certain exercise and certain nutrition, but I refer them out to somebody like you who can better train them to how to lose it. And I like to know, what would you do usually? How do you offer them services to lose their postpartum weight?
Okay, well, first off, as you know, our system is completely online. So patients can access us literally from anywhere in the world, okay? And the first step is really proper diagnosis. We do specific lab workup to really diagnose what's going on with each patient, how their metabolic rate is functioning, what their hormone levels are, and so on. And then based on the results of these tests, we actually make a customized program for each patient that involves an 8-week specific diet plan that will tell them exactly what to eat every single day for breakfast, snack, lunch, snack, and dinner, as well as medical grade supplements. Now I say medical grade because only doctors that practice functional medicine can order these products from the lab, and these products are custom formulations. So for each patient, the products that I choose are completely different. And again, they're based on the lab test results. And once the patients go into the program, then we monitor them once a week. We actually set up a weekly phone follow-up with them and make sure that they're adhering to the program. We motivate them and we coach them. Now, the great thing about our program, I know you mentioned exercise, and exercise is fantastic. We definitely recommend for patients to increase their activity level. But given that most of these patients, as you mentioned, are new moms, they're very stressed, they've got a lot going on, they have a lot of lack of sleep. For a lot of them, it's difficult to exercise. So the good news is that our program does not involve any exercise at all. If you do exercise, obviously you get better results, but even without exercise, within an 8-week period, our patients lose anywhere between 20 to 40 pounds.
Wow, that's great news. And again, usually these patients have a problem losing weight, and definitely this kind of treatment would help them. Again, in my office, I might occasionally start them on some medicine that might help them to lose weight, but these medicines usually have side effects, and it's not optimal for everybody. So diet and nutrition would definitely make a difference for these patients. So we appreciate that, of course.
Yeah, as you mentioned, these medications that a lot of times doctors do prescribe, they do have a lot of side effects. And most of the time when patients get off these medications, unfortunately, they regain the weight back. So what we want to actually do and what functional medicine does is we diagnose the root cause of the obesity and the weight gain, which in a lot of instances can be hormonal changes and metabolic changes, obviously, after pregnancy. And we want to target those issues in the program. And this is where the supplements come in. And they really, really help establish hormonal balance. None of our products have hormones in them, but the natural ingredients of the products actually stimulate your body's hormonal balance to be in check. So it really helps these patients achieve their optimal weight. And when they get to that weight, we put them through a maintenance protocol and they're able to easily maintain it.
Very well. Let's talk about something different. Let's talk about polycystic ovarian syndrome.
Okay.
Yeah, polycystic ovarian syndrome. Let me just give a quick background so everybody knows about what we're talking about. Polycystic ovarian syndrome, or PCOS, is a spectrum of problems. Usually these patients have multiple cysts on the ovaries, which can be diagnosed by ultrasound. They also have usually hirsutism, or extra hair on the face or on the body. They suffer from hair loss. They're prone to have diabetes and a lot of infertility. Besides ultrasound, we usually do some hormone checkup on this patient. They usually have higher testosterone, high DHEAS. As far as the treatment, if they see me, I usually prescribe birth control pill or some kind of birth control to adjust their hormone levels. We give them sometimes spironolactone, which is an anti-testosterone or testosterone blocker, to decrease the testosterone level as far as the extra hair. I might start them on metformin, which is a anti-diabetes medicine, which might help them with the weight loss and makes them more sensitive to insulin. And we might also start them on Clomid if they have an infertility problem, which will stimulate the ovaries and helps them to get pregnant. But these are the things that we do medically. I would like to also, if you can talk about this, that how would you treat as far as maybe a holistic or functional medicine for this kind of patient with PCOS, which is actually very common, and we see a lot of these patients from any age, as far as 16 years old till 45 years old, we see this patient with these complaints.
Absolutely. I'm so glad that you brought up this topic, because polycystic ovarian syndrome has become much more prevalent. And as you said, I see patients, from their teenage years and up that are unfortunately suffering from this. And a lot of them actually don't know, or they have not been properly diagnosed. So I like the fact that you explained how the diagnosis happens. So yes, these patients are usually people who have tried everything and anything, again, to lose weight. They've tried dieting on their own, but due to the fact that a lot of them become insulin resistant, unfortunately, weight loss becomes very difficult. And what we have to do first off is to really target the insulin resistance, because if we don't, then that insulin resistance causes further weight gain, and that further weight gain causes more insulin resistance, and before they know it, they've developed type 2 diabetes. So first off, if the patient does have insulin resistance, then we put them on a protocol which we call insulin resistance control program, or even type 2 diabetes control program. And this is a very specific protocol that really focuses on nutrition. That's going to help these patients lower their blood sugar levels, lower their A1C levels, as well as use specific supplementation that's going to help balance out their blood sugar levels and really help regulate their hormonal levels. And, this type of treatment would really go hand in hand with what you do. And this is why I love collaborating with medical doctors such as yourself, because really there's no piece of the puzzle missing anymore. And we can really help these patients achieve their optimal weight as well as health.
Great, great. That's good news. Now, another problem that almost every patient gets to that point is menopause. Unfortunately, some of the patients have symptoms, menopause symptoms such as hot flashes, and a lot of them end up having weight gains. I have a lot of patients who come to me, they're menopausal, and their only complaint is weight gain. I usually treat these patients with supplements, with prescription medication. We give them usually estrogen, which helps with hot flashes and with osteoporosis and things like that. I occasionally put them on medicine like atenolol if the hot flashes is severe and if they don't want any hormone treatment. But I'm sure there's also some kind of nutrition treatment for these kind of patients that will help them. I tend to refer them out to somebody like you who can help them in that regard. So tell us, if you may, what can these patients do with the menopausal symptoms?
Absolutely, Dr. Naim. Another great topic. So I can tell you that about 40%, maybe even 45% of our female patients that come to us to lose weight are postmenopausal, and some even premenopausal women who have unfortunately put on around 15 to 20 pounds without even changing anything about their activity level or diet. And the type of fat that they gain is just insane because it's locally distributed around the abdomen and the love handles, as well as the hips and thighs and even the upper arms, and that bra fat that you get. And they tell me, regardless of starving themselves and exercising and not eating, they just cannot lose the weight. And this is where an integrative approach is so key, because if those hormones are not balanced and they're not getting the proper medication from you, then unfortunately their results are not going to be optimal with our program. So if they're not already seeing an OBGYN, I tell them that they must see someone to get on the proper medication and do the proper testing and workup. We always get them to check all their hormonal levels. And the device that we ship to these patients to monitor them from home, we call it a body scan device, which has an app that they download. And using that app, when we scan these patients, we can see exactly what's going on with their body internally, even how many calories they're burning at rest. So once we get all this test result, then it's very easy to make a personalized program for each patient that again involves an 8-week diet program. And usually I put these patients in a detox protocol so we can really reset the metabolic rate. And we detox the liver, the kidney, and the GI system. And I have to here say that the GI system, the gut, is so important in weight loss. And this is why you hear a lot of doctors talking about the gut now. The gut has now been named the second brain. So when we detox the GI system, it really helps reset the metabolic rate and also strengthens the immune system. The new research has now shown that the GI system is responsible for 80% of your metabolism as well as your immune system. So once this detox is done, which uses diet and supplements, it's very easy for these patients to lose weight. And again, in an 8-week short-term protocol, they usually lose anywhere between 20 to 40 pounds.
Well, Dr. Heidi, it's good to know that at least there's a treatment for these patients, and some of them ask for surgery, and it's good to know that they can see somebody like you and it would help them, because again, estrogen does not help them with the weight loss. It mainly helps them with their hot flashes and with osteoporosis, and there are other medicines like Fosamax for osteoporosis. Calcium helps, but as far as the weight loss, definitely a treatment plan like that would help them. What I have another question for you about a very common subject that we always hear is COVID-19. I just want to quickly go over it. I know a lot of people recommend vitamin C, maybe zinc, helps them with COVID-19. I know immune system has to be helping them if they get this virus by any chance. Do you have any recommendation for COVID-19 patients or anybody that might be exposed to it, or just in general?
Well, the recommendation is you want to definitely strengthen your immune system.
True.
So, your immune system is so complicated. And as I just mentioned, that the gut is very important for your immune system. So a lot of these patients that unfortunately got COVID-19, they come to us afterwards to do what we call our immune support packages. And basically in these packages, we make a customized supplement program for each patient. Now, what I should mention is our supplements are very different from what you're going to find over the counter. Okay, so these products that we order for patients, only doctors can order them from the lab. And again, they're custom formulations. So like one product is not just made up of, one vitamin or one amino acid. In one product, you may have multiple vitamins, multiple amino acids, and some herbs. So these products are very potent, but they're completely natural, and they will have phenomenal effects on the body. They actually cleanse the entire body, and we give these patients a detox protocol diet as well. And this really helps to reset the immune system. We also take on, I guess, kind of you could say, a preventative role. Now, we cannot say that we can prevent somebody from catching COVID, but we all know that some of us get exposed and we don't get COVID, and other people may get exposed and they do get it. I've even had patients of my own in the same family that, the husband will get it and the wife won't get it, or one or two of the kids will get it. So again, it comes back to your immune system. Right now, more than ever, it's imperative that we're healthy, we're at our ideal weight, and we are disease-free. As you know, people who are overweight and people who are diabetic or have medical conditions are obviously at increased risk with COVID if they do catch it.
Well said. I agree with those, and definitely a good immune system is the way to go.
Absolutely. So we're very excited that we are going to be collaborating. I just want to tell you guys that Dr. Naim and I will be doing regular videos for you guys. So make sure that you guys are following us on Instagram. And the promotion that we have for you guys for watching this video is that both of us are going to be offering a free phone consultation for you guys. So if there's any of you that are suffering from PCOS or postmenopausal symptoms or weight gain or obesity, we can definitely help you. Make sure that you call us or send us a message on our social media, and we will be sure to set up your free phone consultation. And the value of this phone consult is $100, so you make sure that you guys take advantage of it.
Dr. Heidi, that's good news, but it's only for the month of March of this year.
Yes, absolutely. I'm sorry, I forgot that. We don't want to be doing free work forever.
That's true.
Absolutely.
Okay.
Well, I'm
All right.
very excited to move forward.
Great. It was good to see you. We'll chat again next time for sure.
Absolutely. Have a wonderful night, Dr.
You too.
Naim.
Good
And thank
night.
you for watching, everybody.
Thank you.